Good afternoon, everybody, and good morning to our friends on the West Coast. I am Suzanne Spear. I'm the Director of Workforce Development here at ACU, and really just grateful and excited to welcome you to the last of our sessions in this budget period's PCA and HCCN Professional Development Series. And today we are going to be talking all about data. I know it's everyone's favorite and most exciting subject, and we're just grateful that you're here to go along this journey with us. I am joined today by Mariah Blake with our ACU STAR Center faculty. We do have some other members of the team, as you guys know. They're not on today, but just wanted to highlight all of our STAR Center team. Just to take us back to the goals of the series, because it has been a minute since we've talked. I know we talked to you guys in May, but since then, just a little reminder, we are having this professional development series because we want to help you guys build your workforce expertise. You do a lot of different things at your PCAs, and workforce is probably just one of them. So for some of you, it's your full job. But we want, no matter what your job title is, we really want to help expand your workforce expertise and your workforce knowledge. We also are here to share some of your successes, as well as hear it from NTAPs or NCAs, as well as other folks on the line. And lastly, we are here to connect you with others. So take a minute to see who is on the attendee list. Keep an eye on chat to see what your fellow PCA staff are doing, and just really take a minute to just really connect with one another as we go along. Just some webinar housekeeping items. We are recording this session and we will be sending it out via email afterwards. Feel free to ask questions as we go along. You guys know we love questions here at the STAR Center, and we would love any other just thoughts or ideas you have, and you can put those in the chat as we go along. We would love for you to fill out our evaluation at the end, and so we'll leave some time before we close out the Zoom webinar today to put it up there, and so you can fill it out before you even close out of your browser. Last but not least, we do want you guys to have fun. You know we love having fun here, and we want this to be something that you enjoy the hour with us. I know you guys are probably familiar with the Zoom platform, but just in case you need a refresher, here it is. So if you want to put your something in the chat, you can go down to your session controls at the very bottom of your screen. And if you're not seeing them, you can go up to the very top and go into more and say show session control. So go into your session controls, click on chat, and select all panelists and attendees, and that'll make sure that everybody sees what you're chatting. And today, one of the most exciting things that we do as a part of the series, we have some guest speakers, as we have from other parts of this series, some other sessions that we've had. Today, we have our friends from AAPCHO, the Association of Asian Pacific Community Health Organizations, on with us today. So we've got Joe Lee as well as Albert Ayson, and we're just really grateful that they are joining us today, and they always have fun and engaging presentations. And so without further ado, I'm going to hand it over to them. I will be back in the middle of this presentation, but I'm going to hand it over to them right now to take it away.
Thanks so much, Suzanne. Hi, everyone. Hello, friends. My name is Joe Lee. I work as the Training and Technical Assistance Director at AAPCHO. It's so great to be here. I want to give a big shout out to our friends at the ACU for having us. And I see some familiar names on the attendance list. So hello to those who I know. I feel really humbled to be here. I am really excited to share with you some workforce related resources. My last job, I used to work as a workforce development strategist at the Alameda Health Consortium, which is a regional primary care association based in Northern California, where I consulted for 8 FQHCs on clinical retention and recruitment, building enabling services, pipeline programs, and developing workforce partnerships. So it's really nice to kind of tap into that space again. And I also want to have Albert, my colleague Albert, introduce himself too.
Yeah, good afternoon or good morning to you all on the West Coast or Hawaii. I also see some familiar names as Joe. Being in the house in the world, it's always nice to touch base with people that we've worked with. I'm Albert. I'm the Associate Director of Training and Technical Assistance at AAPCHO. And I've actually got 2 years of experience with PCAs and HCCNs with the Chicane's PCA in New York State. And so really excited to really talk about data. And that's the perspective that I'll be bringing for the third learning objective, especially around the importance of social determinants of health, which is something that I'm really passionate about, and how that can really inform your workforce TTA needs. So look forward to the conversation really towards the end and hearing from you all too on how we can support you in furthering your work at your PCAs or HCCNs.
Thank you, Albert. All right, next slide, please. So many of you may have heard of AAPCHO, or for those of you who have not, we are just like ACU, just similar to our friends at ACU. AAPCHO is also a HRSA-funded national cooperative agreement, and we are dedicated to providing quality training and technical assistance for health centers and PCAs. Next slide, please. Just to give you a little bit of history about AAPCHO, we're a national association of 33 community health organizations serving almost 750,000 Asian American, Native Hawaiian, Pacific Islander members or patients across 13 US states and territories. And this is some of our TTA priorities. If you can click on the, maybe click 4 times. There we go. There should be 4 bullets. So we specialize in disaggregated race and ethnicity data collection, SDOH data collection. We're a co-founder of a social risk screening tool called PRAPARE. We also provide TTA on enabling services data collection and class, which stands for culturally and linguistically appropriate services. You'll see a theme here, and that's data collection. We love data, and we understand that you all want to explore using data to identify workforce TTA needs. Next slide, please. So as someone who has worked at a regional primary care association, I can't tell you enough how the right data has been, so helpful in helping the health centers we serve and guiding them to achieve increased access to care, improving population health, and even preparing health centers for value-based healthcare transformation. And as PCAs, I feel like you all have a really great and exciting responsibility to use data to help achieve these specific areas. Next slide, please. So our colleagues at ACU, Suzanne, Sabrina, and Mariah, they relayed some feedback that you all shared as PCAs at your last face-to-face virtual meeting. And these are some of the resources that we'll try to cover today. Some of the themes that we heard was, 1, how can data be used in workforce planning? I understand there's an interest around exploring data sources for workforce engagement and satisfaction, compensation and benefits, and more. So I'll be covering this briefly today. And there was also great interest in learning more about ACU data profiles, as well as how to determine turnover benchmarks. And Suzanne is actually going to present on these tools, and since they are experts on that. And I actually have used one of these tools, the data profiles, when I used to work at the regional PCA, and Suzanne flew out to California to visit one of our member health centers to help them with their retention and recruitment needs. So I think that was the first time Suzanne and I met, so that was fun. And also, we'll be covering how we can use patient demographics data to assess workforce diversity, which I'll help cover briefly. And we'll close out with using non-clinical and or clinical data to identify workforce needs, which Albert will cover. We specialize in enabling services data collection and SDOH data collection. How can those data sources be helpful for workforce planning? Next slide, please. This is a quick preview of our learning objectives. We'll identify data sources, highlight the STAR² Center resources, including data profiles and the turnover tool, and talk about our SDOH and enabling services data. So I can see that I only see my face and Albert's face and the wonderful pictures of Suzanne, Sabrina, and Mariah, and I don't see anyone else's faces. So, and Albert and I, we feed off of engagement. So in the chat box, if you can interact with us, you can say oohs and ahs or say hello, ask questions, make comments. We would love your engagement. So let's get right into learning objective number 1. We can click a couple times to advance the slides. That'd be wonderful. Thanks, Suzanne. So when I used to work at the regional PCA, and the PCA I used to work at was the Alameda Health Consortium, I came across a lot of opinions when working with HR folks at the health centers. And I found that some of the HR folks had a difficult time making a case for pay raises for their staff, adjusting their HIPSA scores, retaining their enabling service programs, and recruiting more students, justifying for a volunteer program, et cetera. And here's a quote that Albert and I love reminding folks, and that is, without data, you're just another person with an opinion. So how can we use data to make evidence-based decisions to address immediate needs? This is a great opportunity for PCAs to help build health center staff's confidence to advocate for specific resources. Next slide, please. So these are based on your feedback that you had relayed. Albert and I took the time to tailor our content today to focus on these specific areas. And these are some data sources that I want to provide a quick introduction to. One is focused on workforce engagement and satisfaction. There's a really powerful engagement strategy known as STAY interviews. Two, I would love to cover a little bit about compensation benefits and relay some of my personal experiences working with PCAs, statewide PCAs, on having an annual compensation and benefits survey, and what are some federal data sources like ONET Online or the Bureau of Labor Services can help benefit you for determining compensation and benefits. And also talking about workforce diversity, how can we ensure that we can have workforce diversity by relying on data sources like the UDS or the National Culturally and Linguistically Appropriate Services or CLAS standards. And I'm going to launch a poll here, or Suzanne's going to help launch a poll. I'm curious to hear from folks, have you heard of or used any of these data sources? Feel free to check all that apply. As PCAs, when you work with your health centers, have you heard of or used state interviews as a strategy for workforce engagement? As a PCA, do you have an annual compensation and benefits survey? Have you heard of ONET Online? Do you use UDS data? Are you familiar with UDS data? Do you use that in your workforce planning efforts? Have you heard of the national CLAS standards, or none of the above, or not sure? So I'll give you a minute to vote here. All right, and then Jude, I see your chats, and I also see Sarah's. Thank you. Okay, so it seems like most of you have an annual survey, great, and that you use UDS data, awesome. And it seems like there's a less familiarity with state interviews. Only half of you have either used it or have heard of this. There's least familiarity with ONET Online, which, great, I'm excited to I have some resources we can walk that through, and then the CLAS standards. Okay, great, this is really helpful. This will help me determine which parts of the presentation I should focus more of my attention on. So I'm gonna go into, let's see, Jude asked a really great question. What kind of experience do you have with salary and benefit surveys? So for the PCAs who are doing that, feel free to chime in with your experiences. I just want to acknowledge all the experts that we have in this virtual room. And let's see, we do an SBT every 2 years because it is a massive project. We're actually in the middle of data collection right now. Great. SBT, can you remind us, Sarah, what SBT means? That would be really great to know. All right, let's go to the next slide, and let's dive into workforce engagement and satisfaction. So about half of you said that you're familiar with state interviews, and I just want to tell a really quick story about the value of state interviews. And if we can go to the next slide, that would be fabulous. One of the health centers I used to consult for, Native American Health Center, thank you, an FQHC based in the Bay Area, they developed an innovative retention program that they adopted for their organization. It's called State Interviews. And they adopted this to address high turnover for providers and staff. And they also want to improve their health center culture and better understand their workforce needs. And through State Interviews, they were actually able to gather valuable data through meaningful one-on-one conversations with employees, and they piloted this in 2015 with all of their medical assistants, care coordinators, and dental assistants. In this slide here, you see two pictures. On the left side are exit interviews. We're all familiar with exit interviews. These are employees who leave, and they tend to not want to burn bridges, and they tend to hide real reasons for their departure. So as a result, there's a missed opportunity for developing proactive solutions. Versus stay interviews, the image on the right-hand side, this program provides high-performing employees an opportunity to hear from their supervisors, we want you to stay. And these are structured and meaningful conversations that allow supervisors to identify areas for improvement. Next slide, please. So at Native American Health Center, they tailored their stay interview questions and asked things like, when you travel to work each day, what things do you look forward to? What are you learning here? How do you learn best? Why do you stay here? They also ask about some sensitive questions too, like what parts are the most challenging? What are some challenging aspects of your everyday work? And this is really a structured conversation that's meant to have between supervisors and their employees to determine what's really motivating employees to stay, or what might be causing them to wanting to leave. Next slide, please. So after the interviews were completed, the supervisors at Native American Health Center, they accumulated their results for their teams. And based on the number of team members who noted reasons for staying, such as work environment, benefits, or job satisfaction, versus number of team members, and they compared that with the total number of team members who noted reasons as to why they might leave. So supervisors took action to make meaningful changes on those very reasons. So as a result, Natives' turnover was 24% in 2017. And this was below the national average, according to the Bureau of Labor Statistics. The 2017 national average for community health was about 30%. And as a result of this pilot, Native American Health Center, they were able to increase their retention by 15%, which was significant for them. And they also found that as a result of doing stay interviews, there was more trust between management and providers. And they use this data to better support their workforce, such as building career ladders for medical assistants and their care coordinators, and their program assistants too. They have program coordinators level 1, 2, and 3. It's just allowed for micro promotions to happen. Native was able to re-benchmark their roles from a compensation standpoint, and they partnered with their statewide PCA, the California PCA, and I see Isa from CPCA on the line. Hey, Isa. And also Native, they were able to pilot flexible schedules because the employees expressed the need for more flexibility in their schedules. So as a result, there was more trust, the employees are happier, Native increased their retention rates. And I thought this was just a stellar, innovative program that was performed by the health center. And the reason why I bring this up as an example of the story is to really relay how, this is use best practices and models like this, and think about how your organization as a PCA, how you can guide and coach health centers to pursue innovative workforce engagement and satisfaction programs like stay interviews. And you can even try it yourself at your PCA organization. Recently at AAPCHO, we did this for our annual staff retreat, and we were able to identify specific benefits that we felt like were really important for all staff, and we're in the process of revising our benefits. So it takes a lot of trust, and it really promotes transparency, and it's something that we feel like it really works. So for those of you who did not know about stay interviews, hopefully you know a little bit more. For more information, just Google stay interviews, and you'll find a ton of resources by SHRM and all these HR vendors. There's just so much information out there. But if you need something more tailored, feel free to let me know. All right, let's move on to the next slide here. I think I saw in the survey that the majority of you are doing compensation and benefit surveys, which is fabulous. And Jude earlier asked what kind of experiences you guys have. So for those of you who have done compensation benefit surveys, please share your experiences and maybe give examples. I screenshotted CPCA's compensation and benefit survey cover here because as a workforce development strategist, when I used to work at the regional PCA, I relied a lot on CPCA's compensation and benefit survey and to help guide our health centers and letting them know, what are the statewide averages for a salary of a community health worker, And the compensation survey was also able to narrow down, from what I remember, salary averages based on a regional basis, like what is it like in the Central Valley versus the Bay Area, Southern California. So this was just really helpful, a really helpful tool. It allows you to build knowledge of current trends. And I think you and I know that there are a ton of healthcare industry compensation surveys out there, but they tend to be geared for more private practices and hospitals. And let's be frank here, they pay a lot more. So we do rely on PCA, annual PCA compensation benefit surveys to get a more realistic picture of our nonprofit, mission-driven health center world and what the compensation benefits look like there. So next slide, please. So I understand that there's least familiarity with the onetonline.org, and this is a tool that I'm really excited to share with you all. And in fact, I'm so sorry, Suzanne, I totally forgot to ask if I could actually share my screen. I would love to just do a really quick live demonstration of, thank you so much. I'm gonna share my screen right here. Hopefully you can see this. So if you go to onetonline.org, you'll come across this webpage right here. And this is a resource that was sponsored by the US Department of Labor. And they use the Bureau of Labor Statistics data for determining compensation averages, the lows and the highs and the averages of occupations. So what's really great, I used to use this as a resource as a workforce development strategist. And if I say, I'm looking for, a certain occupation like community health workers, I'll search for community health workers up here, and it'll give you some titles right here or some closest matches. And luckily there is an occupation here for community health workers. If I click on this, you'll see a lot of just really great data and information that you could use for developing your job descriptions or for workforce planning. This really just outlines, for this particular position, what tasks do community health workers do? What are some technology skills required? What are the abilities or typical work activities look like? So you can see it's really comprehensive here. In the context of compensation and benefits, if you scroll all the way to the bottom, you can see that they'll give you median wages for the entire nation, which looks like it was about $19 an hour. If I were to select my home state here and type in my home zip code, yes, I'm telling you where I live. I live in 94610. If I click go here, you'll just find this wonderful dashboard, this really easy data to show you that, oh, in the Bay Area, looks like community health workers, maybe those who are in the entry level, are paid at around 33 grand. The median is about 53. That seems a little high. I think it's because the Bay Area is really expensive. And you can see comparisons between the regional areas like the Bay Area compared to the state, compared to the United States. So just really quick, compensation data that you can look up. And this data is, again, pulled from the Bureau of Labor Statistics. So I'm gonna stop sharing my screen here. And I really encourage you to utilize this resource to help with any compensation and benefits planning efforts. All right, thank you. All right, so that's a little bit about OneNet. If we can go to ONET. If we can go to the next slide, please. So I'm not going to cover too much detail around this. I think all of you, the majority of you, have expressed that you're very familiar with UDS data. This is a very reliable data source that's used by all health centers, and you can really learn a great deal about your patient population in terms of their demographics. There are a couple limitations that Albert and I want to point out, and that is that the UDS data as a federal data source, there isn't many disaggregation opportunities by race and ethnicity. So for example, with Asian American, Native Hawaiian, Pacific Islander populations, there are over 50 ethnic groups and over 100 languages spoken in the AA and NHPI racial and ethnic group. And we can say the same for Latinx and for Black populations too, where that data is not disaggregated. So, this is something that, that we need to keep in mind. If your state is disaggregating data by race and ethnicity, we would love to hear about your efforts. And also one thing that we want to note is that the UDS does not collect language data. And I think this is something that's a missed opportunity. And I know a lot of health centers collect data on language, especially because health centers serve many patients with limited English proficiency. This is something that can really also help plan for your workforce diversity plans or workforce diversity priorities. So this is something that we want you to keep a lookout for. All right, next slide, please. Okay, how am I doing on time? I'm timing myself. I promised Albert that would take up too much time. All right.
Good, Joe. Go.
Thank you. This is my last slide, and then I'll hand it over to you soon. Workforce diversity. So it sounds like, from what I can remember in the polls, not many of you are familiar with the national class standards, which is okay. I provided a link here to the class standards. This is, we find to be incredibly important for those who want to ensure that they are providing culturally and linguistically appropriate services, that the health centers are providing culturally and linguistically appropriate services. You'll find that the class standards, these are the kind of 3 bucket areas that the national class standards cover: governance, leadership and workforce, communication and language assistance, and engagement, continuous improvement, and accountability. And under each of these buckets, you'll see a number of actions. And in total, there are about 15 action steps. So one example is under the 3rd bucket, for example, how can, is your organization establishing culturally and linguistically appropriate goals, policies, and management accountability, and are you infusing them throughout the organization's planning and operations? And there are a lot of great resources through this website. This was developed by the Office of Minority Health through their Think Cultural Health campaign. And we find this to be really important for workforce development and planning, especially in the context of celebrating diversity and addressing the needs of our diverse communities that we serve. So this is a resource that you can check out on your own time. Thank you, Albert, for providing that link. And we have a couple of questions for you in the next slide. So I just showed you a plethora of sources, and some that you were familiar with, some that you may not have been familiar with. I'm curious to hear from your reactions from you all on your reactions on these data sources. Were these helpful? Were these something that you guys already used? Please feel free to chat in the chat box. We have a couple of questions for you. What types of data sources are you using to help with workforce development and planning, other than the ones that I've mentioned here? And my follow-up question is, how have you used data to advocate for workforce improvement? So I'll have you reflect on this question for a moment, and feel free to chat it in the chat box or unmute yourself and chat with us by voice. Okay, I see my friend Isa. Hello. Seems like you have a workforce development survey. This is separate from your salary survey and online communities. Okay, great. That's great to know that you have a workforce development survey. And from Suzanne Smith, sounds like you used and shared the MIT living wage calculator. Oh, that's great. I didn't know MIT had a living wage calculator. I'm going to their website right now. This is fascinating. You can select a location by state, and then you can select a county too. This is very detailed. This is awesome. Okay, I'm definitely going to use this data when I advocate for a salary increase. Okay, nice. Thank you, Suzanne.
So this is Suzanne at CCHN. I don't know who unmuted me, but the host unmuted me. We used this 2 years ago when we did the salary benefit turnover survey that we do in collaboration with CHAMPS. We used it more at a level of looking at like rural versus urban rather than by county. And we encouraged health centers to look at it. And we know at least one health center did use it when thinking through salary for their lower level clinical support staff.
That's great. That's awesome. Thank you so much, Suzanne, for sharing with us how you use that data. That's really important to distinguish. I agree. The differences between urban and rural areas, that's something that we certainly should be mindful of.
This is Isa. Hey, Joe.
Hi.
Just wanted to really chime in. We released a workforce development survey intentionally. The feedback that we were getting with our salary survey was that it was quite a heavy lift for health centers given the amount of information we were collecting. So we decided to pull out questions from our salary survey that had nothing, or that were not specific to anything that was compensation or benefits related, as a way to minimize the time. And so with the workforce development survey, we were looking at we used questions that targeted or captured interests from health centers around what trainings they're currently hosting within their health centers, but what trainings they're hoping to put forward moving forward, as well as some of the strategies that they're using with recruitment and retention, and then what their interest is on offering different types of or creating different partnerships. So we use a workforce development survey to help us as a PCA more or less understand where we can provide additional trainings or educational webinars, or reach out to different NCAs or state organizations or national organizations to help us address those challenges. And then we use the salary survey specifically just mostly for HR folks, so that they're able to look at hard numbers or make proposals to their leadership teams about what the 50th percentile is for a specific grade or position, et cetera, et cetera.
Great. You said thank you so much for sharing more details. Those are really great examples. I totally support doing surveys that really measure training and technical assistance needs for health centers. This also reminds me about the national needs assessment that's launched by our NCAs and NTAPs. We, I think, launched our first one back in 2018, and we have a second version coming out later this year for health centers to respond to. And we would love to partner with all of our PCA friends here to ensure that health centers are responding to the NCA NTAP surveys, because that helps us narrow down what some of the TTA needs are. And there's also some questions related to workforce there. I see, Katie, you had chatted, make sure for folks who are wanting to chat to everyone, make sure you select panelists and attendees. But one of our friends here, Katie, says that they use salary survey to collect data points on turnover, where providers are coming from, and reasons people leave. That's really great. And it sounds like they're going to use that with state conversations to let them know their biggest needs, and it'll allow us to target different programs. That's awesome. Great. I see a couple of chats around if these resources will be shared when the presentation is shared later. Absolutely. We will have these resources available for you. And I see another person, Ruth, had asked, are the NCA NTAP survey results publicly available? Yeah, so there's actually, if you go to, I believe it's healthcenterinfo. Oh my gosh, I forgot. Is it .com or .org?
.org.
I think it's .org.
Thanks. If you go to healthcenterinfo.org, you should see a summary of the survey results there. I believe NAC also published it on their website. They're the backbone organization helping coordinate the survey. But it's interesting to see the themes across the nation, what health centers are saying are their biggest priorities. I believe the #1 priority last year from the 2018 survey, thank you, Albert, for linking that in, was value-based healthcare transformation, workforce development, I believe, particularly around retention and recruitment. And I forget the other priority. I think it was clinical, something to do with quality improvement. But don't quote me on everything I said here. Check out that summary. It's really helpful, and does it align with your state's priority areas, TTA needs for your health centers? Feel free to compare and contrast that data. Okay, so I think I'm at time for my part. So please have the questions keep on coming in. I'll try to chat and respond to you all. But thank you so much for participating in this discussion. I'm going to turn it over to my best friend, Suzanne, who will share with you more about the the ACU data profiles and the turnover tool that ACU has.
Awesome. Thanks so much, Joe, for going through all of those data sources. I personally learned something, and I hope you guys did too. And someone mentioned in the chat that they asked if we were going to catalog all these resources and send them out. Yes, we're absolutely going to do that. So we're sending the slides out. We'll also go back and make sure that we captured all the chat and all of the information that was sent in there too, and send that out with the recording, because like I said, I think there are some really valuable resources that not only Joe shared, but also some of you guys did as well. So thank you guys for being such active participants in this discussion here. So I am here to talk to you guys a little bit about some resources that we have shared in various formats. And I think you guys pretty much know about some of these resources, but I just wanted to take some time to highlight for you guys in about 5 or 10 minutes about our data profiles and also our turnover tool, because there's some really great, it's mostly quantitative, but it's some qualitative data that you guys can utilize as PCAs to help your health centers with their workforce needs. Okay, so our data profile dashboard, so formerly known as data profiles, we've added the dashboards in there because, as you guys know, they've been transformed. They went from a static PDF to really an interactive Tableau format. So really the thought, as we sort of take the 10,000 point view, 10,000 foot view, view there, sorry you guys, I can't really get my words out this afternoon, but really taking a look at all the workforce data is available and figure out how we can use that data to understand the workforce issues, really at sort of that broad, that 10,000 foot view. And I know we talked a lot about like what kind of data is available. And so we decided to take all of these different things that were available and put them in together as one to figure out how health centers could address their workforce needs. So these data profiles, as you guys know, identify some of the key data points that relate to recruitment and retention at health centers. And it's not the end all and the be all. I think really the takeaway from this session is that there are some really great tools and resources, and you can pull at different points to help health centers understand their workforce needs. So these data profiles really help the health centers, along with all these other different things, help analyze their recruitment and retention efforts, and also compare it to health centers nationwide. So really, this is something that with the data profile dashboards, you can analyze, you can really manipulate the data to figure out how health centers compare on these data points to other health centers around the country. And really, honestly, they're really there to spark a self-assessment about what the needs are. Again, this is not the end all and the be all. We, as Joe mentioned, and as you guys have showcased, there are so many different things that we can use and you can use to help your health centers identify and address workforce needs. And our data profiles are just one of those tools. So our data profile dashboards look like this. So when you look to a health center on the left, that's what it's going to look like. It looks kind of similar to what it looks like as a PDF, but it comes up and you can see the descriptive measures at the top, the number of sites, the HIPSA score, I believe, the number of grantees serving that area. Basically, it's a lot of UDS data, but it's really sort of visualized. And the map is really cool. If you go in, you can click on a zip code or a ZICTA and look to see about all the different, there's a bunch of different information that comes up with each zip code, and it's really cool. And I will say that you guys do have access to these. You currently have access to the 2019 release, and the 2020 version is coming up in the next couple weeks. So please, 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 when you see the email from Mariah, to sign your data use agreement, please go ahead and sign that, because you unfortunately cannot have access to these without signing that data use agreement. So basically just says that you're not going to share it with anybody, that you're going to keep them confidential. But the great thing about having access to these for you guys is you can see what your health centers might be, where their strengths and maybe where their opportunities are. And the dashboards on a individual basis allow you to, and the little box on the right here shows how you can compare and contrast any data point to health centers across the nation, across the state, that are similar size, and all these different, I don't want to say it's infinite ways to compare the data, but it really is so much that you can do with it. So take a look at that, get your login if you haven't. If you need login, or if you want login information to last year's release, and you've signed a data use agreement, feel free to email Mariah and she can get that set up in the right direction. So as I mentioned, this interactive data dashboard is really cool. You can zoom in on the map, you can pan out, you can look at where your sites are, identify areas that you want to target as far as, or health centers want to target as far as their patient population, and all these different kind of things. So really, really so many possibilities. And then I wanted to highlight two awesome points about the data dashboards this year, as the state aggregate reports are back. Last year, we didn't have them. Last year, since we were just rolling them out in Tableau, it was sort of a building year, right? And there were a lot of moving parts and pieces, and we decided to see how it went without the state aggregate reports. Well, I'm happy to report that the state aggregate reports are back. Very exciting for us, very exciting for you guys to be able to take a snapshot look at all of the different health centers in your state and see where the number of flags are for each health center, or for each data point. And so it's really helpful to see where the immediate needs, again, just another source of trying to help you guys figure out where the workforce needs are in your state. Also, too, for our friends that are at the regional associations, as well as by state and CHAD, we have fixed, if you will, increased the functionality of the login so that you can have one login for all of your states. You still have to, when you go into the individual profiles, you still have to click on the individual health center organization in order to see their data, but only one login. So that's great news, especially for you guys at CHAMPS and also at Northwest Regional PCA. And again, stay tuned for more information on that. It's coming, should be released to the week of the 29th, June 29th. And so, but prior to that, you will be receiving the DUA. So, anyway, so stay tuned for more information on that. And always, we are very excited to share those with you guys. And I know I only have about like 2 more minutes, so I just want to sort of walk through the turnover tool with you guys. This is something that we've been talking about for a while with you all. It has been released. We're really excited about it. And we looked at something, let me go back one slide, you know, really for health center organizations and that don't belong to a state that has a salary, benefits, and turnover survey or aren't collecting turnover data, it's really something that they can go in and help them to identify strategies that they can, to help them improve their retention, figure out why people are leaving. Also give them some recommendations and some reading, but finally to collect turnover data, you know, to collect turnover data. And again, you can take a look here and also on your slides. It really will help them identify why people are leaving their organization and you know what they can possibly do that for. Also wanted to highlight here that we're not just collecting this for physicians and providers. It is, you know, dental hygienists and support staff as well as dental assistants. So, you know, again, some of you might be collecting all of this, some of you might not. I know it varies from state to state, but this tool is designed to collect data for an abundance of different positions at health centers. Really, the biggest and coolest thing about this is that it's allowing for collection of turnover data on a national basis. We are still working with the organizations that collect this on either an annual or semi-annual basis, and figuring out how we're going to really gel everything together and have it come out and be something that we can use on a national basis. But we're really excited to work with you guys on this. Stay tuned for some more information, how we can work with you guys to help disseminate this, especially for those of you who aren't collecting turnover data. But then also the other exciting thing about this is that you guys are going to be, we're going to be able to give this information to you guys on an aggregated basis to figure out where, where the needs are at health centers, either, regionally, statewide, and also nationally. So once we have enough data on for each year, we'll be able to share this with you guys, combine it with what is already being collected out there that you guys are already doing, and then really get a snapshot of turnover on a national basis. So we're really excited about that. Since Table 5A is going away with UDS this year, there's really nothing that talks about turnover. So again, stay tuned for some more information, and make sure that you keep a look at our newsletters and also regional calls, all of that kind of good stuff for information. And yeah, that's about it for me right now. I will tell you guys that, that we're all about using data to develop a strategy for your recruitment and retention efforts. And so we have lots of other things on our website to help you do that. But just wanted to highlight those two resources today. So with that, I will hand it over to Albert, and he will take you through learning objective number 3.
Woo. All right, Joe and Suzanne, thank you. I know we have 14 minutes left, so I'm going to try to get through this material. And if not, there are going to be plenty of more webinars and sessions in the next 3 years, so don't you worry. So again, I'm here to really talk about leveraging social determinants of health and enabling services data, given that there's a lot of emphasis at HRSA to really focus on the workforce, and more so than ever, enabling services workforce, whether that's your community health workers, your health educators, referral specialists, you name them. They're an integral part in addressing some of the social determinants of health that a lot of the patients are experiencing. And it's even more relevant now with the pandemic and all the talk about racism as a public health issue. Social determinants of health is going to be in everyone's face, as you probably are seeing in the news. And we know that more health centers are actually collecting and starting to expand their standardized data collection efforts for social determinants and enabling services. So I hope that this next session will just give you a brief demonstration on how you all at the PCAs and HCCNs can leverage these separate yet related data sets to inform your future TTA development and delivery strategies. And I see in the chat box that is some of the strategy that you all are planning for your work plans. This might be helpful as you talk to your perhaps quality improvement teams at your PCAs and HCCNs, or health IT teams. So next slide. Okay, so we all know, as Joe mentioned, that UDS is great, but it also has some limitations. But I'm excited to know that in 2019 for UDS, we have 2 new questions related to health centers' capacity on screening for social risk factors. And on this screen here, you'll see that the 2 questions are, does your health center collect data on individual patient social risk factors? Basically, yes, no. And then the second question is, which standardized screeners for social risk factors do you use? And there are plenty of social risk screening tools out there, but the one that AAPCHO is comfortable talking about is PRAPARE. So I'll just give you a sample and an example of how that could be used for workforce training and technical assistance. Next slide. All right, so some of you have probably seen this slide in other presentations, whether it's related to PRAPARE or AAPCHO's enabling services data collection. Again, I mentioned PRAPARE today, and I want to emphasize that there are other tools that you're going to be hearing from your health centers on what they're using, whether that's the Accountable Healthcare Communities tool or something internally developed. But in any case, the social risk factor data is really vital and important to understand the individual or population level needs of patients that are making them, worse for their health outcomes or overall patient care. So the needs data here on the left side is, again, one part of the equation. And then on the right side, the response data, that's where the enabling services or response data comes in. And these are the interventions that will perhaps address some of those socioeconomic factors that, again, are affecting your patients. And with pandemic going on, we're hearing some of the top needs are housing instability, food insecurity, employment, on insurance, domestic violence. And so really, if you can address those needs, a lot of the clinical needs can be addressed. And to the point about reducing physician burnout, I think a lot of the physicians can allocate those roles and responsibilities on addressing social determinants of health to a more interdisciplinary team that includes your enabling services staff at the health centers, and really using their experiences as a community health worker or as a health educator that lives and represents the community. That really does bring the value to the health center program. And at the bottom of your screen here, I think this is where PCAs and HCCNs do help in terms of using aggregate level type of data, whether that's, again, clinical or non-clinical data, to demonstrate the value of your health center network, to reduce total cost of care or improving health outcomes, you name it. More data can really help paint that bigger picture on why this is important for, again, sustaining value-based healthcare and PPS for the health center program. Next slide. So some of you may be asking, I know the audience here may not be the ones to talk about PRAPARE or the social determinants, but there's a lot of data out there floating out in the cloud of the different EHRs or in the different population health management vendor tools. Again, PRAPARE has 16 questions that are considered core social determinants measures, and that includes race, ethnicity, income, insurance, and those are actually part of the UDS. As you see on the asterisk, the first 9 are already collected by health centers. But what we're finding is the other core measures, so number 10 down to 16, education to housing stability, those are the ones that are really missing from the data sets at the health centers. And the more that health centers can standardize that data, the more that they can act on it and address these top social risk factors at the health center level. And really the half of the equation, the enabling services workforce that we want to talk about more and more, is they are going to be able to connect the patient outside of the clinic walls with the community-based organizations or with the social service organizations to ensure that there's a wider safety net, because some health centers that are large could provide that enabling service in-house and connect patients to those services in their comforts of their 4 walls, but others who are smaller and not so resourced will need to look at partnership building as the next step. So the questionnaire, and Joe will highlight the link in the chat box, but this is available for you to look at in more detail on what questions are being asked. And these are, again, aligned with national guideline and standards like PCMH, meaningful use, IOM, or UDS. So this is already data that health centers are going to be asked to collect, not as an optional basis, but really as a mandatory basis. Next slide. The other data source, again, the response data or interventions data, is enabling services. This is something that we're seeing more demand for as HRSA requests more kind of that workforce perspective on what types of services are being provided to address social determinants. And so AAPCHO back in the day developed these codes and categories with the help of some pilot health centers in 2004 and 2007. And these were the most common, again, categories and codes that were used in a pilot study. And we've expanded those categories and codes in 2017 to really, again, distinguish, for example, social services assessment versus case management. A referral could be for health versus the actual social service. So the different categories here are really meant for the health center to see what their staffing models are like and what their resources are being allocated towards for enabling services. And it's helpful for some health centers to, again, hire another community health worker or case manager to address some of the patient's social needs. And these codes on the right side that you see are dummy codes, and we're working with LOINC to make sure that these are, again, used for more billing purposes. So that could be helpful for your operations and finance teams so that they can track these services on the back end and perhaps, again, get reimbursed by your local health plan or the payers in your state or region as you start seeing more of these services documented. And I will just mention that a valid entry for this data has to meet some criteria, since it, again, needs to be provided by a health center staff member or volunteer or contractor. It needs to be a patient that's connected to the medical visit so that they have a patient ID. Then you can track that data. And then also the service must be directly provided to the patient or by a primary caregiver. So those are just some of the criteria in our toolkit that you can find more details on, which I will link later. Next slide. All right, so I know I have 5 minutes left, so I'm going to rush through this. Just giving you a sense of the time intensity data that is available in the enabling services protocol. If you can measure the amount of time that an enabling services provider is spending on health education versus referral, that's even more rich data for you to say, hey, we need to hire more of these staff, so that way we're not burning out our workforce, or retaining our workforce, because you're really looking at them as valuable team members of the care team. And so if you are able to help your health centers really track this data electronically, this could help feedback up to the PCA or HCCN to, again, talk about that value proposition or the value-based care work that you might be doing now with your Medicaid or health plans. So more info, and again, in that toolkit. Next slide. And I just want to mention that these templates are available in various EHRs, both the PRAPARE and the enabling services. You'll see here, this is GE Centricity. On the left side, this is the PRAPARE form. And then on the right side, this is the enabling services form. And you'll see here that there are these radio buttons so that you can click which the amount of time that a health educator or a enabling services provider overall spent with a patient. So this can be, again, reported and aggregated on a monthly basis, a quarterly basis, and it can even be reported out on a site level or organization level, so that way you can really see the full spectrum of all the services you're providing non-clinically. All right, next slide. These next two slides are just really examples for you all to take. I won't read off the screen, but for health centers, again, they are leveraging this data so that they can reallocate their resources so that they can hire more staff or maybe move staff into different departments, whether that's from the social work department to the clinical team. We're finding that really the team-based care huddles where they have a community health worker or a referral specialist in the mix does help with continuity of care and also patient satisfaction. There's more research studies coming out from the academic arena on the correlation between enabling services and the intensity of it, and also improved health outcomes. And that includes your diabetes A1C measures going down. That includes your ER utilization visits going down. So we can share some of that literature as well if you need more background on the value of this work. Next slide. This is for the PCAs and HCCN, since this is the audience today. You can really use this type of data to really look at the type of TTA that you want to manage or deliver to your health centers. I'll just throw out some examples. You can use trainings to provide cultural humility training. You can provide motivational interviewing training. What else? Trauma-informed care. There are a lot of great trainings that can really assist in the health centers addressing and collecting data on social determinants of health. And we have a lot of great partners at the state PCA level or at the national NTAP level that can really support you all in doing a train-to-trainer program so that you all can be trainers of your health centers. Or you can do again, statewide or regional training where you bring in experts and you bring in all your health centers to, again, learn about trauma-informed care, cultural humility, et cetera. So I just want to let you know that this data really may not be directly in your face all the time, but it could be useful moving forward. And I'm just going to say this next slide here. PCAs and health centers and HCCNs can really drive that transformation to the state and national level by using, again, that data to talk to your Medicaid ACOs and using data to talk about risk stratification and risk scoring, That's a whole nother training in and of itself, but really tackling your high-risk patients using that type of SDOH and enabling services data. And we're seeing some great examples out there on negotiating payments, capitated payments per member per month, where your patient populations are getting more services thanks to the reimbursements to compensate for enabling services work. So I'll let you read this on your own time since we have just a minute. And next slide. Okay, we don't have time for discussion questions, but I would love to hear again from you all, maybe offline. But yeah, what are you currently doing to support your health centers to collect the SDOH and enabling services workforce data? And in what ways could you use this data to provide better TTA? So I will end there because I know Suzanne, Mariah, you need to close out.
Yes, well, thank you to Joe and Albert both. Like I said, I learned so much, and I hope you guys did as well. Thank you all also for being such an engaged audience. We always love this time with you guys because you're so willing to share and ask questions, and I really hope that you guys feel like you're getting a lot out of the hours that we spend with you guys. So it is our last session of this series, of this budget period, but we're going to keep in touch with you guys. Please feel free to send us your questions and needs. You're going to get these slides and the recording and the other resources that we saw in chat. We're also going to be sending out some information later on, not immediately, about these sessions in the fall and how we're going to structure them, what we're going to talk about and all that. So again, thank you guys for you all, our PCA friends, for being with us today, and a special thanks to Albert and Joe for joining us. Please fill out the session evaluation before you close your browser, and take care, everybody, and we'll talk to you very soon. Thanks so much. Bye-bye, you guys.